Did you know that just one small bedtime habit could silently stop your heart in the middle of the night without a single warning sign? Every year, over 70,000 adults over 60 die in their sleep, not from old age, but from seemingly harmless habits that trigger hidden risks while you rest. The surprising truth? After 60, your body becomes far more sensitive. Something as routine as a late night glass of water or sleeping on your back could quietly spike your blood pressure, disrupt your heartbeat, or even lead to a stroke. As a health professional working with seniors for over 8 years, I've seen how small changes at night can lead to massive improvements or serious consequences if ignored. But the good news is, with a few simple adjustments, you can protect your heart, brain, and energy levels starting tonight. In the next 3 minutes, I'll reveal 7 dangerous sleep habits and what to do instead. You'll learn how to lower your risk of nighttime heart events by up to 68%. Sleep deeper even if you usually wake up to pee and feel more rested in the morning without medication. Just ask Diane, 68. She once fainted walking to the bathroom at 2 a.m. After changing habit number 2, she hasn't had a single incident in over 2 years. If you think your routine is safe, this may be the most important video you watch all year. Don't ignore these signs because the real danger is what you don't feel. These next 3 habits may seem small, but they quietly shorten your sleep and your lifespan, one night at a time. Habit number 7, drinking too much water before bed. Water is essential, but drinking large amounts in the evening, especially after 7 p.m., can become a serious problem as we age. Your kidneys slow down, your bladder holds less, and the urge to go comes more suddenly. That means you're more likely to wake up in the middle of the night. And that moment, getting up half asleep in the dark with low blood pressure, can be dangerous. Even a short trip to the bathroom can lead to a fall. The CDC confirms that nighttime falls are the leading cause of injury-related hospitalizations for older adults. But there is a simple fix. Drink plenty of water earlier in the day and taper off after 6 p.m. You can protect your sleep and stay safer starting tonight. Habit number 6, eating late at night. A warm bowl of noodles, a small dessert, or a light porridge might seem comforting. But for people over 60, late-night meals can overload your system. When you eat close to bedtime, your body stays busy digesting instead of resting. That can lead to acid reflux, indigestion, and extra stress on the heart. Foods like fried snacks, bread, or sweet fruit can spike your blood sugar and keep your blood pressure high. You may be asleep, but your heart is not. Have you ever woken up at 3 a.m. with chest burning or shortness of breath? That is not something to ignore. Try finishing dinner by 7 p.m. If you need a snack, choose warm milk, a banana, or a few almonds. Habit number 5, sleeping in the wrong position. Many people feel comfortable sleeping on their back, but for older adults, this position can be dangerous. Lying on your back can block your airway. Your tongue and throat tissues relax and fall back, making breathing shallow without you even noticing. Doctors say that back sleeping increases the risk of stroke, heart failure, and memory problems. Even if you do not snore, sleep apnea can still happen silently. Diane, age 68, used to wake up tired and forgetful, even after 8 hours of sleep. After switching to her left side and raising her head slightly, she felt sharper in just 1 month. If you tend to sleep on your back, try placing a pillow behind you to stay on your left side. That small change each night gives your heart and brain the rest they need. You might think you're doing everything right at bedtime, but these next 3 habits could quietly put your health at serious risk. Habit number 4, sleeping in a hot room. Many older adults like to close all the windows, turn up the heat, and use heavy blankets to stay warm at night. But a hot bedroom can actually disturb your body's natural sleep rhythm. To fall into deep sleep, your core temperature needs to drop slightly. If your room is over 70 degrees Fahrenheit or 21 degrees Celsius, that process is blocked. You toss and turn, wake up often, and feel tired in the morning. Studies show that older adults sleeping in warm rooms lose up to 30% of deep restorative sleep. That's the sleep stage your brain, heart, and immune system rely on to recover, and it gets worse. Sweating at night can cause dehydration. Thicker blood and lower fluid levels increase the risk of clots, irregular heartbeats, and even strokes. What to do? Keep your room between 60 and 67 degrees Fahrenheit. Use light, breathable sheets and crack a window or run a fan to keep air moving gently. Habit number 3, getting out of bed too quickly. One night, Uncle Ray, 74, woke up needing the bathroom. He stood up fast, lost balance, and hit his head on the dresser. That fall sent him to the hospital for 2 months. The cause? Something called postural hypotension, a sudden drop in blood pressure when you stand up too fast after lying down. It's especially dangerous at night when blood pressure is naturally lower. Your brain doesn't get enough blood right away, making you dizzy or faint. This is one of the top reasons seniors fall at night, and falls can lead to fractures, brain injuries, and even permanent loss of independence. What to do? After waking, sit up slowly, wiggle your toes, move your hands, take a deep breath, then stand. Use nightlights and wear non-slip slippers for extra safety. Habit number 2, ignoring snoring and chronic insomnia. Some say snoring is harmless, or that poor sleep is just part of getting older. But the truth is, loud snoring, breathing pauses, or constant insomnia could be signs of sleep apnea, a dangerous, often hidden disorder. When your airway closes during sleep, your oxygen drops, your heart races, your brain struggles to rest. The Sleep Heart Health Study found that sleep apnea increases the risk of stroke by 60% and heart attack by 30% in seniors. Even worse, up to 80% of sleep apnea cases go undiagnosed. Many people sleep alone or simply don't realize the signs. Watch for these clues: loud snoring, gasping, dry mouth, headaches in the morning, or feeling tired all day despite sleeping enough. What to do? See a sleep specialist if you notice these symptoms. Simple changes like adjusting your sleeping position, using a CPAP machine, or losing a few pounds can dramatically improve your sleep and protect your heart and brain. Habit number 1, taking the wrong medications before bed. For many older adults, taking pills before bed is part of their nightly routine, whether it's a sleeping aid, blood pressure pill, or pain reliever. But some medications, if taken at the wrong time or without proper guidance, can silently increase your risk of confusion, dizziness, and even heart complications during sleep. First, sedatives. While they may help you fall asleep faster, they also slow down your breathing and reduce oxygen levels, especially risky if you have heart or lung conditions. Many seniors feel groggy or unsteady the next morning without realizing it's the lingering effect of nighttime medications. Painkillers and anti-inflammatory drugs can overwork your liver and kidneys overnight, disrupt your sleep, and raise the risk of internal bleeding, especially when mixed with other drugs. Even blood pressure pills, when taken at night, may lower your pressure too much while you sleep, reducing blood flow to your brain and heart. That can quietly increase the risk of stroke. What to do? Always consult your doctor or pharmacist about the best time to take each medication. If you feel unusually sleepy, foggy, or still tired after a full night's rest, your body may be reacting to the wrong drug combination. Sleep is meant to restore your body, but even one harmful habit, like drinking water too late, eating before bed, or sleeping in the wrong position, can turn nighttime into a hidden risk. The good news is, you don't need to change everything at once. Start with one small step tonight. Drink a little less water. Sit up slowly when you wake. Pay attention to your sleep patterns. If any of these habits sound familiar, share your experience in the comments. Your story might help someone else sleep more safely. If you found this video helpful, please give it a like and subscribe to our channel. Every peaceful night you gain is one step closer to living strong, independent, and healthy in your later years. Thank you for spending your time with us today. We deeply appreciate your presence and trust. We look forward to seeing you again on your journey to better sleep and a better life after 60.